Namaste बिटिया हमेशा खुश रहो बिटिया. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science in JAYOTI VIDYAPEETH Women's University. In today's lecture, we are going to discuss about influenza. Influenza is an acute respiratory illness that is caused by the infection with influenza virus. It affects the upper and the lower respiratory tract. Systemic signs and symptoms consist of fever, headache, myalgia, and weakness. The outbreaks of illness occurs nearly every year, resulting in the significant morbidity and mortality rates among the high-risk patients, mainly as a result of pulmonary complications. Influenza virus belongs to Orthomyxoviridae family. Influenza A, B, and C viruses constitute of three separate genera. Type A, B, and C is differentiated on antigenic characteristics of nucleoprotein and matrix proportion antigen. Influenza A is further subdivided on the basis of surface antigens hemagglutinin H and neuraminidase N. The individual strains are designated according to the site of origin, isolate number, year of isolation, and subtype. The genetic shift results in the circulation of a new influenza strain within the community to which people are immune, initiating an influenza epidemic or pandemic. Influenza is acquired form of aerosolized respiratory secretions of acutely ill individuals, hand-to-hand contact, and other personal or fomite contacts. There is viral shedding usually stops 2 to 5 days after the disease onset. Epidemiology. The influenza outbreak occurs virtually every year. The extent and severity vary widely. The localized outbreaks takes place at variable intervals, usually 1 to 3 years. The global pandemics have occurred at the variable interval. The most recent pandemic is COVID-19 outbreak in January 2020 that rapidly spread worldwide over the next several months. Before that, it is in March 2009 and was caused by an influenza A H1N1. Interpandemic influenza A outbreaks usually begins abruptly, peak over a 2 to 3 week period, generally lasting for 2 to 3 months, and often subside almost as rapidly as they began. The pandemic influenza may begin with rapid transmission at multiple locations, have high attack rates, and extend beyond the usual seasonality, with the multiple waves of attack before or after the main outbreak. The extent and severity of the outbreak is the level of immunity in the population at risk. Emergence of antigenically novel influenza virus to which little or no immunity, extensive outbreaks may occur. Influenza A virus, the most extensive and most severe outbreaks of influenza are caused by influenza A virus. The propensity of H and N antigens of influenza A virus to undergo periodic antigen variations. Major antigenic variations are called as antigenic shift. It is seen only with influenza A viruses and is associated with pandemics. The minor variations are called as antigenic drift. Influenza B virus. It causes outbreaks that are generally less extensive and less severe than those caused by influenza A virus. Heme agglutinin and neuraminidase of influenza B virus undergo less frequent and less extensive variations. Next, we have influenza C virus. It is a minor cause of disease in humans. It has been associated with common cold-like symptoms and with lower respiratory tract illness. Now the clinical manifestations. Influenza is a respiratory illness that is characterized by systemic symptoms such as headache, feverishness, chills, myalgia, and malaise. Respiratory tract signs and symptoms, particularly cough and sore throat. The spectrum is wide, ranging from a mild afebrile respiratory illness, similar to the common cold, to the severe prostrations with relatively few respiratory signs and symptoms. The symptom onset can be gradual or abrupt. Presenting feature. The fever with 38 to 41 degrees Celsius. Fever may last as long as 1 week. There is feverish feeling and chillness, but true rigors are rare. Headache is generalized or frontal and often troublesome. The myalgias are most common in the legs and lumbosacral area. Arthralgias may also develop. Respiratory symptoms consist of sore throat or persistent cough, lasting for greater than 1 week, often accompanied by substernal discomfort. Ocular features consist of pain on motion of the eyes, photophobia, and burning of the eyes. General symptoms consist of anorexia, malaise, weakness, and dizziness. Physical findings consist of the skin is hot and dry. The pharynx have severe sore throat, injections of mucous membranes, and postnasal discharges. There is mild cervical lymphadenopathy. The rhonchi, wheezes, and scattered rales are reported with variable frequency. Now, the outcome. The outcome in uncomplicated cases, the acute illness that resolves over 2 to 5 days and most recovered in 1 week. The cough may persist for 1 to 2 weeks longer, and in the elderly, symptoms of weakness or lassitude. The post-influenza asthenia persists for several weeks. Next, we have the complications. The complications occurs most frequently in patients greater than 65 years old and in those with certain chronic disorders. High-risk groups consist of the cardiac or pulmonary diseases like diabetes mellitus, hemoglobinopathies, renal dysfunctions, and immunosuppression. Pregnancy in the second or third trimester, and children less than 5 years old. The pulmonary complication consists of the most significant complications of influenza is pneumonia. It can be primary influenza, viral pneumonia, secondary bacterial pneumonia, and mixed viral and bacterial pneumonia. The primary influenza viral pneumonia is the least common but most severe of the pneumonic complications, most often affecting patients with mitral stenosis and pregnant women. The secondary bacterial pneumonia is usually due to Streptococcus pneumoniae, Staphylococcus aureus, or Haemophilus influenzae, and presents as the reappearance of fever and respiratory symptoms after 2 to 3 days of clinical improvement. Extrapulmonary complications consist of myositis, myocarditis, pericarditis, central nervous system complications like encephalitis, toxic shock syndrome, and Reye's syndrome. It is a serious complication in children. Lab finding and diagnosis. Virus detection in the throat swabs, nasopharyngeal swabs, or washes or sputum. Reverse transcriptase polymerase chain reaction, RT-PCR. Serological methods require comparison of antibody titers in sera obtained during the acute illness with those in the sera obtained 10 to 14 days after the onset of illness. Other laboratory tests generally are not helpful in specific diagnosis of influenza. Now we come to the treatment. The specific antiviral therapy, that is zanamivir and oseltamivir of 5-day course. Antibacterial drugs for the treatment of bacterial complications, antibiotics guided by gram staining and culture of appropriate specimens of the respiratory secretions. Acetaminophen or non-steroidal anti-inflammatory agents for the relief of headache, myalgia, and fever. Prophylaxis, activated and live attenuated influenza vaccine. So this was all about influenza. In the next lecture, we will be discussing about infectious mononucleosis. This session was powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. This was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.